I think the most important thing when we're talking about diet is really finding something that is sustainable for you that is better than the standard American diet. Hello and welcome everybody to the Spinal podcast. My name is Dr. Brian Joves and thank you for joining me today. Today, I want to do something that is going to be helpful for me as I have recently been going through this journey of a diagnosis of squamous cell carcinoma and trying to figure out what life is going to feel like or be like afterwards. I think part of me really wants to lean into this idea of wellness and overall health. And part of that is nutrition. I have always had a very keen interest in nutrition. I wrote my master's thesis in nutrition, working with the Framingham study back in 2005, and have really kind of found that as the basis of how I think about approaching health and think about approaching wellness. And have really thought about this and spent a lot of time over the past couple of weeks recovering from surgery, reading about the different options that we have for nutrition. And so I really want to just kind of walk you through my thought process as I've been kind of recovering and figuring out what I think is going to be best for me going forward, but also how this relates to our patients and why it's important for us to pay a little bit of attention to it. I think, obviously everybody understands that nutrition is a fundamental part of health and a fundamental part of wellness, but it really is not something that a lot of us in medicine get a lot of training in. I think I'm, probably the outlier in terms of somebody who, spent way too many hours reading nutrition studies and learning about nutrition. If you actually look at the surveys of medical students, 58% of them in a recent study said that they got no formal nutrition training. And of those that did, the average was about 3 total hours. So if you think about 3 hours in the span of medical training, it is quite literally nothing. And so, which leads us to the more data that says that only 15% of physicians feel that they are rightfully prepared and educated to offer nutrition advice to their patients. With contrast that to the fact that, the same study quoted that 73% of physicians feel that it is their job and believe that it should be a part of the routine care to discuss nutrition with their patients. And so there's this huge gap of knowledge that we have in the medical field for nutrition. And I think that is one of the things that I just want to kind of walk through and talk through today. The basics that we can start with are really that the standard American diet is bad. And I don't think anybody is going to argue with that because the data is overwhelming, right? Standard American diet is made up of ultra processed foods, refined sugars, etc. And all of these refined sugars and ultra processed foods, increase our sugar uptake by exponential amounts, right? And so if we just think about the very, very simple idea of the standard American diet, it is ultra processed, it is easy, it comes in a box, it doesn't expire. Um, it allows for people to, be busy and get food on the go, right? I mean, this is why we've created exponential number of multi-billion-dollar companies from McDonald's to Procter and Gamble, et cetera, that are all based off of this idea of the Western diet, the standard American diet being ultra processed and making things not real food. And so, the studies have shown that the average American scores 11 out of 100 in terms of diet quality. Um, and so obviously that's going to correlate with everything from obesity to diabetes to heart disease to chronic pain, even to cancer. And so as we use that as the backdrop of what we know about nutrition and what we need to figure out how to work through, I think there is a lot of ways that we can think about nutrition. But, there are, because of that, I am truly of the belief and have been and have talked about this with my patients. And you can even go back to our episodes in 2019 and 2020 with two episodes, and that's my fault. In the 150 episodes we've done of this podcast that have talked about nutrition. But I'm desperately of the belief that for the average person, whatever diet is the most sustainable for you is the one that you should stick with, because anything that we do is better than the standard American diet. And I think that, when we talk about nutrition, or when you get lost in the weeds of nutrition, right? You start listening to all of these medical experts or health influencers, and they're all talking about such nuanced things, very, very discrete things about, oh, is this diet, is keto versus, you know, carnivore versus, you know, vegan versus blah blah blah, the Mediterranean diet. So, background, my thesis was dietary quality and weight gain in women. So once again, published with the Framingham study back in 2005, and that study, based off of decades of following the Framingham cohort, found that a Mediterranean diet was the least likely to lead to long-term weight gain for patients. And obviously, we know the correlations between weight gain and chronic pain and all of the other comorbidities that and health problems that end up coming through. And so I think as long as you can find something that is not the standard American diet, that is going to be better for you in the long haul. And that goes for all of our patients as well as for us as healthcare providers. But there are nuances and there are things that will make different choices possibly better at different points. I will also frame that nutrition studies are incredibly hard. Trying to get people to stick to a specific program over a long period of time for nutrition is very hard. So most nutrition studies are flawed. They are not as perfect as we would want them to be, but that's okay because this is the real world and the real world is flawed. So one of the things I wanted to start with as we're going through the discussion of literature is we'll kind of start with the context of our patients, right? Who we normally talk about here on the Spine and Nerve podcast is patients who are living with chronic pain. And a study that was published back in 2020, so we actually reviewed it on that episode that we did back in 2020, was talking about patients with chronic spinal pain. And it followed the NHANES data and showed that patients who live with chronic spinal pain have very poor dietary index, which means that their diet quality overall was very, very poor. I think the most specific thing that I noticed out of that study was that their sugar consumption was significantly higher than what would be expected in the normal population, and also what would be ideal for them. It's a hard thing to interpret because I think there's two ways to look at it. Obviously, I don't think that necessarily the increased sugar intake led to the chronic pain. I do think that the data would suggest that the increased sugar does not help long term with the chronic pain. But in the short term, that increased sugar probably fires their dopamine receptors, which makes them feel better for a time. So they almost use this poor eating as a coping mechanism to help with their chronic pain. And so I think that's one of the challenges that we know exists in our patients, right? Are as people who are treating patients that live with chronic pain, we know that they are living in these circumstances, and we are going to have to figure out how to help educate them in a way that can get them past the immediate need to feel better, right? A donut will make me feel better for the next 15 minutes. There's probably no doubt about that. I think we can all agree on that. I would love to have a donut right now. But I also know that that is going to lead to other long-term problems. And I think that kind of leads me into maybe this next step of the conversation, which is how have I looked at the literature and thought about this as I am now a cancer patient, right? I currently no longer have cancer. It has been removed from my body, but I am a patient that has been diagnosed with cancer. And as I'm looking through the data and trying to figure this out, I kind of went back to some of the basic science to try to understand what I can do. Because just like anybody else who goes through any medical diagnosis, I think we all want to be able to have whatever control that we can have, right? And as somebody who had no risk factors for oral squamous cell carcinoma, not a smoker, not a heavy drinker, exercise regularly, generally had have a very healthy diet. Consider myself an athlete still at 42, but we want to do whatever we can to try to help ourselves have the highest success rate possible. So one of the things that we know about cancer cells is something that's called the Warburg effect, where many cancer cells really heavily rely on glucose as the way that they are able to be fed and the way that they're able to grow. And so, if cancer cells rely mainly on glucose, and some studies have shown like a 50-fold increase in the amount of glucose that these cells utilize as opposed to other cells in our body, is there a way that I can decrease the circulating amount of glucose to therefore decrease the amount available for these cells to use? And so that brought me to a ketogenic diet, right? Where I would do my best to decrease the amount of glucose that is circulating in the system to make it, in theory, less likely that these cells have the fuel that they need to be able to grow. And so there have been studies that have looked into the ketogenic diet, both in mice models as well as in human beings. But human beings are tough, right? Obviously, we talked about the limitations of nutrition studies in human beings, and there have been some studies that have showed improvements in quality of life, fatigue, a lot of metabolic markers. There are great preclinical data as well as some clinical data that shows potential tumor growth attenuation, reduced inflammation markers, immune modulation. Not all the studies are perfect, and I think that there are some studies that have shown, potential increased risks of things like metastasis. And so, it is all to be taken a little bit with a grain of salt, right? We want to look at this, and these are just tools, and that everybody can try to be able to find what is best for them. I also will kind of put this in the backdrop of when I did my master's thesis back in 2005, and I spent a lot of time reading nutrition literature and even nutrition books. There was a book that was out at the time that was called The China Study. And it was probably one of the most influential books for me at that time. I think if I'm being honest, I would have guessed that based off of that book, if I ever was diagnosed with cancer, that I would have thought about doing a vegan diet, which is what they used in this uh, in the China study, right? But this was kind of specific for a certain type of cancer. It was a stomach cancer, and it found a relation between actually meat intake and this type of cancer. And so it was, I think now 20 years removed, my interpretation is that there was something about this meat in this area because it was very specific to a portion or a village in China, and they did a great job on the study. But I thought for the longest time that that would have been my approach if I was ever diagnosed with cancer. As I've kind of processed it over the past few weeks with this diagnosis and recovery, that has not been the takeaway that I have taken. And so, some of the other reasons why I have decided for myself that keto was the way that I wanted to go was kind of looking at some of the data of, fasting versus fasting mimicking diet as a complement to, you know, uh, management of cancer, right? And so there were some early trials that suggested cycles of fasting mimicking can reduce insulin resistance, so improving systemic inflammation, potentially enhance uh, chemoimmunotherapy for patients. And so I think that when we're thinking about fasting or fasting mimicking, that falls in line with a ketogenic diet. And so I think that's kind of how my mind has been able to process it. And I'm definitely not saying that the way that I have thought about it is the end all be all. I think there are a lot of different ways to be able to interpret the data. Um, but it is, an individual choice. And once again, I want to fall back on the thought that I do believe that as long as we're conscious and conscientious about the choices that we're making for diet, and so whether you're choosing to be a whole foods vegan, right? I want to kind of caveat that when we're talking about a vegan, is not ultra processed vegan foods like Beyond Burgers, and things along those lines that are what is going to drive the health effects of a vegan diet. It would be taking in whole foods to such as vegetables and fruits that are going to be helpful. But regardless of if you're looking at these diets for cancer or for pain, we do have to understand that we require this holistic approach, right? We have to approach the diet, we have to approach our movement, our sleep, our mental health, uh, all from in a thoughtful way. And so I will say that I think if you look at the data, and regardless of which type of nutritional road you want to choose, processed sugars lead to inflammation, and processed sugars are probably the most likely risk factor for just about everything that we can think about, right? And so if we want to try to help our patients and we want to try to help ourselves, I think that trying to stay away from that processed sugar, processed food portion of the standard American diet is the main key. And so once again, whether that's vegan, whether that's Mediterranean, whether that's carnivore or keto or whatever it may be, staying away from the processed sugars, ultra processed foods is going to be the most important aspect for it. And so we can probably start with very small, practical ways of being able to do it, right? I've constantly thought about how do we educate our patients, because you're not going to overhaul their entire diet right off the bat, right? Very rarely. I'm not saying that I haven't had patients that we've had this conversation and they have transitioned, very quickly to something different. But generally speaking, nutrition is so hard because it's intertwined into everything we do in life. And it's a part of celebrations. It's a part of processing. It's a part of grieving. We get the dopamine effects of that sugar, and so it is all a very, very challenging thing to try to change. And so, how do we do this in small steps? I think there are probably two main things that we can start with. I think the ultra processed sugars that come in many, many drinks are probably the easiest thing to start with, right? And so if we can talk to patients about soda consumption, even diet soda consumption, but most importantly the full sugar versions of them, or you know athletic drinks, sweet tea with all of the added sugars to it, or whatever may be their favorite Starbucks coffee, right? That 60-gram hit of sugar in a 12 to 16-ounce drink is probably the easiest first step, right? How can we start to just decrease that portion? And then slowly over time, replacing the easy choices of boxed foods, of fast food, of the ultra processed with more whole foods. And so if we can work towards decreasing those drinks and increasing real food, I think that's probably the best and easiest approach to kind of slowly transitioning this process for ourselves and for our patients, and trying to get them to take those steps, right? I think I have talked about this in one of the podcasts before. I got to work with a tremendous integrative medicine doctor back in my training. And when he would do these groups for patients living with chronic pain, one of the first things that he would talk about, when we're thinking about diet and health, was consistently eating real food and just trying to stop soda, right? I mean, if you can drink water, if we can drink water instead of those other choices, those little steps can make a huge difference, right? Yes, they're likely to get benefits from their weight, but most importantly, they're going to get benefits in the long term for their pain, for their diabetes, for their risk of heart disease, and once again, likely for their risks of cancer. And so I think that is really the easiest and most approachable way to start this process, right? And if we can, as physicians and healthcare providers, remind ourselves as well as reminding our patients that nutrition is not optional. It is foundational for healing, for recovery, for living well. Then we can use that as a tool, just like we use all of the other tools that we have in our tool belt for treating our patients. And so you know, at this point, we're in 2025, we're in a world where most of the education that we get as physicians is outside of the medical school conference halls and lectures, right? We're seeking information everywhere. How, we have not been taught about nutrition and about how we can educate our patients and work with them to better their lives. But it is our jobs to try to figure out how to do that. And so, once again, I am not Andrew Huberman. I am not here to give you a 3 hour deep dive into the very, very fine details of all of these. But if you're so inspired to learn more, I mean, I think there are some phenomenal resources that are out there. But starting with small, approachable steps, right? We know from everything that we've learned from our patients and from all of the studies about how to influence lifestyle factors have to start small to make them sustainable because us overhauling everything and it lasting a month is never going to make the difference that we want it to. It is about small, sustainable changes that over time get to that compound effect and start to make the difference for everybody. So, guys, thank you so much for listening. I hope that you learned something interesting. If you have been on a nutrition journey of your own, please let me know about it. I'd love to know how you have interpreted this literature and how you have tried to make this decision in terms of what is going to be best for yourself. But once again, sustainable changes are the way that we are going to help ourselves the most. So thank you all for listening, and we will talk.